A leading public health expert, Dr. Pankania, is calling for more visitors to be allowed into care homes if there's an outbreak of COVID. As our health correspondent Matthew Hill reports, current guidelines say only essential carers can go in if there's more than one case of the virus.
It's like missed this huge chunk of all their lives.
Joy is mourning the lost memories her son will never be able to have with his father, Tom. And when's the last time you saw him in the same room?
2 years. And they hugged and hugged and hugged. He kept poking his dad. I can't believe it's you, Dad. I can't believe it's you. It's like he was 5 years old again.
The 81-year-old's been in a care home throughout the pandemic. But with limited visiting slots in his home, Joy feels she can only visit him twice a week.
These other people that have been in contact with the people who've had COVID can go and do personal care for my husband. And yet I can't visit him. And I don't understand those rules. I just don't understand why everybody else is free and they don't take in consideration the mental health and the human rights of these residents.
As an essential caregiver, Joy is able to visit her husband if there's an outbreak of COVID. But current guidelines don't allow this for other relatives. Now, that's something a leading expert in public health says must change, given the right precautions.
You test negative, you are assessed that you haven't got any new signs and symptoms, you wear your mask, and then you're escorted to your loved one's room, and you didn't interfere with anything else in the nursing home. Where are the risks?
In a statement, the Department of Health and Social Care say throughout the pandemic they've done everything they can to keep both staff and residents safe, and that it's very clear that essential caregivers should be allowed access. They say they've also brought down the timing of restrictions from 28 days during an outbreak to just 14.
This is Dearborn Manor. We've got 62 beds here.
Yeah. But from April, free lateral flow tests will no longer be available.
If they're going to have to pay £20 per week for a lateral flow test every day, that's going to be quite a lot of money over a month. I think that would just be unfair.
But today, Joy had good news. The homes say visiting slots are now unlimited, but others who may not be as lucky will no doubt be calling for restrictions to be lightened. Matthew Hill, BBC Points West, Portishead.
And across the southwest, there's been an increase in the number of patients in hospital with COVID, but it's a very different situation, thankfully, from 12 months ago. Andrew has been looking through all the figures, and he's here now. Andrew, it's like old times.
It is. We haven't done this for ages, have we? No, we haven't had to, of course, but coronavirus hasn't gone away. It's worth keeping an eye on, and people may have seen reports in the papers over the past couple of days that there has been an increase in hospital admissions and COVID cases here in the southwest. Now, that's true, but it's not the full story, so let's just explore that a little bit. We've got a graph, as always, which will show people at home. It's pretty basic. This shows you the whole of the recorded cases throughout the last 2 years. You can ignore the left, really, just go straight to the right, and you can see there has been an uptick. It's gone up over the past couple of weeks, really. That's not just here in the southwest, but across all of England. So why is that happening? It's kind of a mixture of things, really. The most obvious one, of course, is that we've got no restrictions on our behaviour at all. So people are mixing more. Some of the people who have been shielding, really, for 2 years, been very careful, they've sort of emerged out as well. Unshielding, they're calling it. So they're sort of mixing as well a lot more. There's also a slightly different strain of Omicron around. It's called BA2 rather than BA1. It's not more harmful, but it is slightly more infectious. And also those people who are sort of classed as more vulnerable, generally speaking, loosely grouped as the over 55s, they tend to be the people who got their jabs first, i.e. quite a long time ago. And while that gives you immunity, that does wane over time. So all those things are sort of coming together to see this uptick in cases, not just here, but across all of England.
I suppose, does it matter is the question?
Well, that is the question, isn't it? And the answer is yes, but I think there are some quite big caveats to that, because although we are seeing an increase in hospital admissions, and we've got another graph just to illustrate that this is across all of the southwest hospital admissions, people in hospital with COVID, you can see it's just going up there lately, but we are a very long way from some of the peaks we saw at other times during the pandemic, not just in terms of cases, but also in terms of hospital admissions, but also in terms of people who get very, very sick. So people who need intensive care ventilators, ITU beds, that number is really, really low. And deaths as well, that number is also extremely low. So I think, although it's true to say we have seen an increase in hospital admissions and cases as well because of all those factors, we're not seeing people get really, really sick, and that is because, of course, most people are protected by the vaccines. What it will mean, though, is that there will be more boosters in future. And in fact, we know next month they're going to be rolling out another booster offer to people over 75 or who are sort of clinically vulnerable, who've got compromised immune systems. And in the future, I think there's likely to be more boosters for the rest of us as well.
Okay, Andrew, good to see you and your graphs back with us. Thank you.